Good afternoon. I'm Danielle Ponzio, joint replacement surgeon at the Rothman Institute. Today I'm speaking on patient acquisition, how to drive volume to your ASC. By way of disclosure, I am a part owner of the Rothman ASCs, including the center where I operate, which is AtlantiCare Center for Orthopedic Surgery. It is a joint venture with our local hospital system, which is AtlantiCare. We opened our doors in November of 2020, and I was the first surgeon to perform an outpatient total joint replacement at our new center. To highlight some advances that have shifted our patients toward outpatient surgery, simplified VTE prophylaxis, optimized wound closure and dressings, blood management, including addition of TXA, multimodal pain and anesthesia protocols, immediate postoperative weight bearing, accelerated rehabilitation protocols, with an overall premise of keeping it simple to enable patients to succeed, limiting people, steps, intervention, and criteria to discharge, and really eliminating interventions such as drains, Foleys, pain pumps, and relying on minimal use of opioids. Overall, there's a number of motivating factors from a bigger picture as well, including a natural progression towards outpatient surgery that has largely been driven by the Medicare rule change, taking total knee replacement and total hip replacement off of the inpatient only list. In addition, the COVID-19 pandemic fueled further progression towards outpatient surgery in the ASC venue, with an avoidance of hospitalizations, as well as freeing up resources during the pandemic associated with the hospital. Patient safety, of course, was emphasized and is a concern. Research does suggest that ASC outpatient total joint replacement is a safe practice and certainly is associated with high patient satisfaction and surgeon satisfaction. All of these factors have contributed to the overall growth of outpatient total joint replacement in the United States, with a projection that by 2026, the majority of procedures will be performed in the outpatient setting. And so this certainly lends to patient acquisition, because there's going to be a natural tendency of patients coming into the office looking for outpatient surgery and interested in outpatient surgery and ultimately eager to learn more about it. Part of that is going to be patient education. And that's really where it begins when you first meet the patient in the office at the initial consultation. Preoperative education classes can often be valuable. E-newsletters, we have a timed email series that we offer patients that's interactive up to 6 weeks before surgery and 6 months after surgery. But the real important thing here is that there's a uniform message being delivered to the patient to offer preoperative education that guides them through the experience, so that they're prepared for the outpatient experience in particular. Patient selection is key to this process and key to patient acquisition. There are office criteria that ought to be applied again at that first inpatient, at the first in-office consultation, rather. Patients should be motivated and agreeable for outpatient surgery. You should be making some assessment regarding things such as anxiety that may prohibit a patient from being successful in the outpatient realm. Mobility and functional status are important, whether the patient has help at home or can make an arrangement to have help at home, their home layout, and then medical hard stops that may dictate that patient should be treated in an inpatient facility rather than at the ASC. Pre-admission testing is a key component of the success of our program, and there are medical hard stops that really dictate the patient should be treated at the hospital. These are some of those criteria that we apply when evaluating a patient for the proper setting for surgery. More formally, to discuss marketing as far as patient acquisition goes, there's a number of avenues that can be employed. Social media is certainly a popular way of getting news out there, updates out there, and brand development to deliver some content to the general community. This is an example of the first surgery that was completed at our ASC and getting that content out to our community. Other kind of avenues to reach the community: lectures, patient seminars. So we routinely offer these types of things. Same day joint replacement is a hot topic. And so it's something that patients want to hear about and they have a lot of questions about. And so these types of seminars are generally well attended. Reaching out to your referral base, so primary care providers, physical therapists, having some avenues for CME. This is another way to get the word out. And it's really not common knowledge that total joint replacement can be performed in an outpatient setting. And so bringing that information to the table can go a long way as far as bringing patients to your center. And making it well known that this is sort of a state of the art and up and coming way of performing joint replacement that patients really ought to seek out. Patient satisfaction. This is perhaps the most important thing on this list because this is what it's all about. And patient satisfaction translates into different grading and ranking systems, such as health grades. Patients having great outcomes and getting back to the activities that they love to do. Those are the things we like to share. And, patients speak to one another and refer friends and family. And so this is really a key way to attract patients to your center. Publications. This article was published in the Philadelphia Inquirer, and they highlighted one of my patients who had surgery at our surgical center. And her quote was highlighted to say, "It was just like being in Disney. When I went into the operating room, I was introduced to every single person in there, and they seemed to be so happy. The best medical decision I ever made was to do this." And so this is obviously a great way to inform the general public, your community, of what it is that you're doing as far as the ASC. You can use other avenues such as magazines, websites, blogs, press releases, but these are great opportunities to communicate information about your center. More formal advertising is also an option. So that may be by way of billboards, radio ads, newspaper ads, podcasts. And I think one caution here would be to ensure that there's no misrepresentation of information, and also that you're really sticking to evidence-based medicine as far as avoiding making any claims that one technology may be better than another, unless it's driven by evidence. Finally, offering visitation and tours to your ASC is another way that patients can build confidence going into surgery in the outpatient setting. We recently developed a video tour of our center, and I think that's been a nice thing to offer to patients. And then patients do pre-admission testing in the same building, and so they have access to the facility prior to the day of their surgery. They're welcome at any time to take a tour, and I think this is one other thing that is just an asset to the experience. Overall, there are many keys to success when it comes to outpatient surgery in an ASC. Certainly, having a state of the art facility and infrastructure in place goes a long way. But patient acquisition, patient selection, education is really important and really key. Engage perioperative providers, standardize well designed protocols, surgical efficiency, teamwork. Of course, these are all key components. And then after surgery, having research and surveys and follow up in place to ensure that you're reviewing the data, improving upon the processes, and ultimately prioritizing the patient outcome and then highlighting that outcome, because that, again, is what it's all about. And that's what's going to attract more patients to come to the center. Thank you for your attention. Enjoy the rest of your talks.